Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We're going to be talking neurology this evening with a expert, very experienced neurologist in this area from his practices right here in Pompano Beach. He is Dr. Shahab Kidwai, and like I said, neurology. So we're going to be talking a lot about, headaches, and then, is a migraine a headache? And then general neurology. So stick with us. If you have any questions, it's 1-888-565-1470. But I'm going to get right into it. Dr. Kidwai, welcome to the program. How are you doing this evening?
Fine, thank you.
Thank you for joining us. I always say on this adventure of health, because we always learn so much from the great physicians in South Florida here. Please tell the viewers and listeners a little about what you do. We know your medical specialty is general neurology, but love to hear it in your words.
Well, yeah, I'm a general neurologist, and I've been in practice for 30 years, and I see all kind of neurological problems.
Mm-hmm.
Headaches is very common. I see at least 2 to 3 patients every day.
I'm just going to move this a little closer. There we go.
So I see at least 2 to 3 patients every day, and I've been seeing them for 30 years, so I know a little bit about headaches.
Yeah, very busy neurologist.
Yes.
Yeah, you do know, I think you know a lot about headaches. So let's get right into it. Is headaches the most common neurological ailment that you treat?
Yes.
Okay, so that's number one.
Yes.
Okay. Now, I always had a question. Well, I'm going to get right into it. I tease that about the migraines versus headaches. But what about headache treatment? Can you help people with relief from headaches?
Well, that depends upon what's the cause of the headache, because headache is 80% of the headaches are which we call primary headaches, and they include the migraine headaches and tension headache or mixed headaches. 20% of the headaches are which we call secondary headache or due to some other serious cause. So first we have to differentiate if there is a primary headache or a secondary headache. Secondary means if it is from any brain tumor, head injury, or any other disease which may be causing the headache. Or if none of them applies, then by history and examination, we are able to tell usually in the beginning that it is a primary or secondary headache, and treatment based is on that. First, we have to make the diagnosis what type of headache they have.
Okay, so secondary, if I got this right, is more from a cause, traumatic brain injury, any brain of that tumor, sort. Yeah. And then primary, it may come from genetics, history, maybe diet, that sort of thing?
Yes, which is the most common headache, the primary headache. 80% are primary headaches.
And this is the question that I was teasing before. Is there a difference between a migraine and a headache?
No, migraine is also a headache.
Okay. I didn't know that.
Yes. Migraine is the one type of headache, which is the very common headache. And is what we call disabling headache. In this headache, person is not usually able to function while he is experiencing headache, as compared to the tension headache, which is very more common than migraine actually. But in the tension headache, The difference is it's not that severe, and the person is still able to function through that. Even though they feel miserable, but they're still able to function. There are three characteristics which they differentiate. One is this, that the person is still able to perform their activities during the tension type headache, but the migraine is so disabling they are not able to do it. Then they have light sensitivity in the migraine, and they have nausea feeling. Those three things are main component of the migraine. And while in tension headache, they just have a tight, squeezing, heavy feeling on the head. They don't have any nausea, they don't have any light sensitivity, and they're able to function through that. So intensity is less in the tension headache.
Yeah, you can function with the tension headache. So we're here with the headache expert, Dr. Shahab Kidwai. He's a neurologist. I think you said 30 years of experience in this area. That is great news. Very expert. He has the expertise you need. It's Dr. Shahab Kidwai, 954-783-0222. He's right here in Pompano Beach, 2000 North Federal Highway, Suite 203 in Pompano Beach, and he's been there for 20 years. It's a busy neurology practice, but like I said, if you have any questions, give that number a call. He is the headache expert. So, Dr. Kidwai, I know a little bit about migraine, and I'm going to tie this into a legend here in South Florida, Dwayne Wade, the basketball player. It's been, widely publicized when he played for the Miami Heat. Well, he played everywhere. He's always struggled with migraines, and he actually missed a few games because of that same thing you were saying. He'd get a horrible migraine. He couldn't really function, and then the light really affected
light sensitivity, yes.
Yeah, so
noise sensitivity, light sensitivity, and they just feel miserable. It's a pounding, severe headache. They just like to sit in the dark room and try to sleep. Sleep usually helps in many patients with the headache, and it depends upon the person. That it may last from few hours to few days.
Oh wow, I didn't know that. Okay,
yes.
A few hours to a few days. Now, when you make the diagnosis, whether it's migraine or tension, let's start with migraine. What are the treatment options available today that you offer?
That treatment depends upon the frequency of the headaches. If someone comes to us and tells us they get 1 or 2 attacks a month, and we ask them how long each attack usually lasts. If they last for a few hours or even just for about a day, we give them what we call abortive treatment. The abortive treatment means we give them some medication to get rid of that particular attack on that day. But if someone has a headache 2 or 3 times a week, that's a very frequent headaches. They cannot take those abortive treatments that often. So we give them what we call preventive medications. They have to take those preventive medications every day to prevent these headaches from coming on. With preventive medication reduces the number of headaches, intensity of the headaches, so it makes their life more tolerable.
So if someone's having either of these ailments, neurological ailments, the best thing is to see a general neurologist so they can start the workup to, find out, make the diagnosis, and find out what works in that particular case.
Yes.
Okay, good news. So if you're looking for a neurologist, we have an expert right here, Dr. Shahab Kidwai. Like I said, right here in Pompano Beach, 954-783-0222. Are there signs? So if someone's never had a migraine, are there signs and symptoms of a migraine that are, I guess, different than a tension headache? You just named some of them there.
They are very different. Migraine headaches can be on one side of the head, or the whole head may be involved. And usually the headache is a pounding type of headache, and they do get light sensitivity, nausea, blurring of the vision, and they just feel miserable and they cannot function through that. As compared to the tension headache is more like a daily dull pressure, heavy feeling on the head, like a tight band around the head, but they don't have any other associated symptoms with that. And many times people have what we call mixed headache. They have both. They get migraine attacks, and in between they get tension headache. So they can have both type of headache. This is also not uncommon, mixed headache syndrome.
I didn't know that either, that it can be a mixed headache syndrome. Yes. That's why we do this show. We learn so much from the great physicians in this area. Thanks for sharing that as well. I wanted to ask you, and Can diet or I guess not a proper sleep schedule trigger either of these types of headaches?
Yes, there are a lot of triggering factors for the headaches, all kind of headache, migraine or tension or mixed. Stress is the number one cause for any physical stress or emotional stress. They can trigger migraine, they can trigger tension headache. And for the migraine, lack of sleep is very triggering factor. Sometimes oversleeping can also cause migraine. The going out in the hot sun, if they are sensitive to bright light, they can trigger migraine. In the women, the menstrual period is the period in which they usually get what we call menstrual migraine. Sometimes certain food can trigger migraine. More notorious are like a red wine, Chinese food, or chocolates. But again, the food does not apply to everybody. About 15% of the patients are sensitive to food. And beside these three which I mentioned, there could be anything, some special cheese products. Some people can be sensitive to it. So everyone has to find their own experience. If they eat something or drink something and they get a headache, always after that. So that's a triggering factor for them. So they have to try to stay away from them.
I think the thing to take away is if you're having headaches, definitely see a neurologist. Dr. Kidwai is the expert in this area, 954-783-0222. He's right here in Pompano Beach, 2000 North Federal Highway, Suite 203. Like I said, Pompano Beach. Dr. Kidwai, hold those thoughts. We're going to talk a little bit about migraines and headaches a little bit more, but also general neurology, stroke, dementia, etc. on the You and Your Doctor show.
Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to the You and Your Doctor show, Living a Longer and Healthier Life. We're here with Dr. Shahab Kidwai, a neurologist, 2000 North Federal Highway, Suite 203 in Pompano Beach, 954-783-0222. Dr. Kidwai is Dr. Kidwai, I should say. Sorry about that. Is a headache and migraine, tension headache and migraine expert. What I was saying during the break, Dr. Kidwai, we had a little time to talk a little bit more. This society is moving so fast. Everyone needs everything pronto. I need this right now. I need to get over here. Traffic's crazy. We're dealing with a lot of stress, and a light bulb went on, and man, headaches must be on the rise just due to the amount of stress we cause.
Yes, stress is the number one triggering factor for any kind of headache.
I didn't know that. That is just something. So everyone just needs to chill out. And if you have these issues, go see a neurologist. We have great ones in the area, but we have a headache expert right here, Dr. Kidwai. So I'm going to give out the info a couple more times. Let's turn. I know you do a lot of general neurology. Obviously, I mean, you've been in practice so many years. So what can you tell us about stroke? What are some of the signs and symptoms, and how can we keep healthy and not have a stroke?
Yeah, stroke lately there have been a lot of progress in the prevention of the stroke. The thing that usually causes stroke is blood pressure problem, diabetes, heart conditions, high cholesterol in the blood. So in order to prevent the strokes, we make sure that the cholesterol is under control, blood pressure remain under control, diabetes under control, and we give them some blood thinner like aspirin, or if somebody needs stronger than that, then we give the other medication for them. So healthy lifestyle control of these main factors is the one that go for the prevention of the strokes.
Great to know, yeah, because definitely a thing that's always in the news is stroke. Seems to be more prevalent nowadays than when I was a little bit younger. I didn't hear too much about it. I know it's been there. Now, dementia, we hear the general population hears that all the time, but unless you've known someone who had dementia, or that if you haven't known someone or know the story, so I'd like to have you explain a little bit about dementia, signs and symptoms, and et cetera. Is there a way we can keep from getting dementia?
Yes, dementia is increasing in frequency because the lifespan is increasing. People are living longer than before. So after the age of 85, about 50% of the people do develop some memory problems. And as the age advances, we see more and more difficulties with the cognitive functions. By the time they reach the 95, only 4 to 5% of the people retain their normal cognitive functions. So it's a normal degenerative process of the brain. And most common cause of the dementia is Alzheimer's disease. And there are a lot of research going on, but so far we don't have any cure for it or prevention for it. We do have 4 medications available, which they just slow down the process, but they don't eliminate the process.
So Alzheimer's disease, if I get this correct, like you just said, and dementia, they can go hand in hand.
No, dementia is a symptom.
Okay, symptom of
Alzheimer's disease is the actual diagnosis. That's the disease which causes the dementia. And dementia later was just a confused person. And memory impairment, judgment impairment, all those, you just call that as dementia. But what causing the dementia is the diagnosis. Alzheimer's is the most common cause for the dementia. But there are a lot of other causes also, but Alzheimer's is the most common one. This is a normal degenerative process in the brain.
I tell you, I'm learning a lot here. Dementia is the symptom, and Alzheimer's is the disease.
Actual diagnosis, yes.
The diagnosis and disease. We have Dr. Shahab Kidwai here. He is an expert neurologist. Headache, we've talked about. The difference between tension headaches and migraines. Talk a little bit about stroke, dementia as a symptom, and Alzheimer's disease as the diagnosis. So we're really moving along here. Great info. He's right here in Pompano Beach, 2000 North Federal Highway, Suite 203. He's been there for 20 years. It's an established general neurology practice. 954-783-0222, and I'll give that info out another time before we leave. What are some of the other neurological ailments that we haven't talked about that you see a lot of in the office besides those headaches, stroke, dementia, Alzheimer's disease?
We see a lot of patients with dizziness, balance problem, neuropathies, carpal tunnel syndrome, neck pains, back pains, Parkinson's disease, or tremors. Those are the usual ones.
Now, dizziness, that's interesting because that's something that it kind of come and go?
Well, it depends what's causing the dizziness. Dizziness can be from a very serious neurological condition, or it can be, there's a type of dizziness is called benign positional vertigo, which is not uncommon, and that's not a serious problem, but it can be very annoying. Then dizziness can be a very minor symptom just coming from the stress.
Oh, from stress again?
Yes.
So if people are living a stressful life, they definitely probably going to develop some ailments.
Yeah. Their dizziness is usually more like a lightheaded type feeling, not related to change of position. And when we get detailed history and examination is normal, and we ask them if they have been under stress, and so we suspect that if we rule out any other possibility.
Okay, you're getting the bottom of it, Dr. Shahab Kidwai here, expert neurologist. What are some of the treatment options for dizziness? What are you prescribing?
Well, that depends upon what's causing their dizziness. If they have a benign positional vertigo, then there is some medication. Meclizine is the most commonly used medication for vertigo. Vertigo is a type of dizziness in which they have a sense of rotation, spinning, or body, head spinning, or room spinning around them. That particular feeling is called vertigo. And the other type of dizziness is a lightheaded sensation, which can be from other reasons, like if they have orthostatic hypotension, if they get dizziness only when they stand up quickly, if they are taking a lot of blood pressure medications or have diabetes, they can get that kind of dizziness. Or as I said, if they are not related to change of position, it can be just from the stress. But the serious kind of dizziness, if when they have vertigo, along with that, they have some other symptoms like seeing double, or speech problems, slurring of the speech, or numbness on the face, arm, or leg, that indicates the stroke. So it's a posterior circulation stroke. So we ask them all those questions, and based on then we make the diagnosis of it's a serious kind of dizziness, or it's a less serious like benign positional vertigo, or just a stress-related, or pre-syncope, what we call, from the drop in the blood pressure on standing, and the elderly people who take a lot of medications and have diabetes or blood pressure, that they come and tell us that they feel dizzy, lightheaded, as if they're going to pass out, or they sometimes even pass out when they get up quickly. We check their blood pressure on supine position and standing position and see if there is any significant drop, more than 20 points of systolic. So we suspect they have what we call positional hypotension, orthostatic hypotension. So they are treated differently. They have, and the one who has a benign positional vertigo type, and they give them the meclizine, we tell them to do certain vestibular exercises. There's a police maneuver, we perform that to break their dizziness cycle. If we suspect it's a stroke, we send them to the hospital, because there's a stroke comes from the blockage of the circulation in the back part of the brain, the posterior circulation, vertebro-basilar system, and that can be a serious stroke if it's not taken care of immediately. So we send them to the hospital. But that's not a common type dizziness. Most common type are this like a benign positional vertigo that we call, or the orthostatic hypotension causing the lightheaded type dizziness, or the stress-related dizziness. They are more common.
Yeah, so every case, what I'm taking away is every case is different, and there's different, ways to treat it, and the best thing to do is see a neurologist, if you have dizziness, neuropathy, as well as, someone maybe who has dementia, you're a caregiver and you notice something as well, or, those tension headaches and migraines like we started the show out with is the expert here is in this area is Dr. Shahab Kidwai, neurologist. Again, right here in Pompano Beach, 2000 North Federal Highway, Suite 203, Pompano Beach, 954-783-0222. You take most major insurances?
Yes.
That's always a question that all the people ask me. So.
Yeah, I take all the insurance. Yeah.
Okay, great. Well, we have less than a minute. I want to thank you for making the drive over and sharing. This has been such an informative interview, from the dizziness to the tension headaches, dementia and Alzheimer's disease, migraines. Wow, ton of info in 30 minutes. Thank you.
Okay, thank you.
And I look forward, to the show next time. Bringing you, experts like Dr. Shahab Kidwai, the neurologist here. So tune in next week, and we'll see you then on the You and Your Doctor Living a Longer and Healthier Life show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422 and we will put you on the air as soon as possible. Tune in next week for more information on living longer and happy.